Final speaker for the spring is Thomas Moore, and he's at the University of Arizona in Heidi Brown's lab, and he's a PhD candidate in epidemiology in the Melanie Zuckerman College of Public Health at the University of Arizona, and he is going to be talking about identifying potential action thresholds and areas of high risk West Nile virus exposure in Pinal County in Arizona. So welcome, Thomas.
Great, thank you. Just allow me a minute to share my screen here. Okay, perfect. Can everyone hear me and see my slides?
That looks good.
All right, terrific. Well, good afternoon, everyone. I am Tom Moore, and the title of this project is Identifying Potential Action Thresholds in Areas of High Risk West Nile Virus Exposure in Pinal County, Arizona. This project is mentored by my advisor, Dr. Heidi Brown, and is in collaboration with Pinal County Public Health Services District and the Arizona Department of Health Services. This project is also a component of my dissertation work, which is examining the utility of mosquito surveillance to identify areas of high-risk West Nile virus exposure in rural and urban environments of the United States. There we go. So before diving into the project, I'd like to give some background on Pinal County. The map on the right of the slide shows where Pinal is located in Arizona. It's sandwiched between Maricopa County to the northwest and Pima County to the south. Geographically, it's about the size of Connecticut and has a population of almost 500,000. It's considered a rural and agricultural county. Historically, the largest cash crop has been cotton. So if you ever come and visit Arizona during harvest, you might see all the cotton flowing around the roads. This slide shows a map of Pinal County displaying how land use is distributed. The black boundaries show each of the municipalities within Pinal. So as we can see, the majority of land use in Pinal is made up of shrubland and agriculture, with few spots of urbanization kind of in the center points of the municipalities. So Pinal County's current operation has 2 staff members assigned for surveillance, control, and nuisance complaints. So as you can imagine, that is a lot of ground to cover for 2 people. There are 32 CO2 traps total that are placed weekly across the county. And current thresholds for control are either 250 QLEX species in a trap without West Nile virus, or a trap containing 100 QLEX species that have tested positive. The county will also fog if there's an observed trend during surveillance. Recently in 2021, Arizona was overwhelmed with West Nile virus cases, most of which were found in Maricopa County, where our major city Phoenix is located. However, Pinal County was no exception. They had a total of 121 cases, combined confirmed and probable that season, which is a lot. And we'll kind of go into what a lot looks like for this county later in my slides. But a challenge that Pinal County has had in the past has been the ability to calibrate thresholds for when to initiate control and messaging. I first learned of this challenge in Pinal County earlier in my PhD work, and I would sit in on these meetings where it was expressed that, vector index doesn't work in Pinal. And vector index was I would say, hot measurement coming out of CEC, Roger Nashi would come visit different public health authorities saying, use vector index, but Pinal County hasn't been able to identify any type of entomological indices associated with human incidents of West Nile virus yet. So the overall goal of this project is to support Pinal County's West Nile virus surveillance and control efforts by enhancing interpretations of routinely collected mosquito data and identifying useful West Nile virus risk measures with the hope of developing data-driven action thresholds. So we hypothesize that collectively through weather, environmental, social, and existing mosquito surveillance data, we can identify risk measures quantitatively associated with the incidence of human West Nile virus. The specific aims of this project are twofold. One, to identify entomological parameters temporarily associated with human West Nile virus incidence, and two, to identify environment, weather, and social determinants of human West Nile virus incidence in association with collected mosquito data. So to accomplish these aims, we're using mosquito trapping and testing data from as far back as 2012 and exploring how this data is temporally and spatially connected with human West Nile virus cases through use of modeling. Then as we're building our model, we hope to identify important weather, environment, and social drivers. So in a related work, we conducted a systematic literature review of studies attempting to quantitatively connect entomological risk measurements with human West Nile virus incidence. So in this related work, we restricted our search to the contiguous United States, and findings were grouped and summarized into 8 regions as developed by the AMCA. So this slide gives a summary of what we found in the South Pacific region of the US, which is where all of us are located. And so we're using this related work as a starting place for our analysis of this project. And so if you see here on the left in this table, the different temporal scales, spatial scales, the different types of models used, but the entomological indices, that's what we want to identify and potentially use for our action thresholds. And then in the map of the US here, we're here, South Pacific, and this shows a chart, a pie chart of different drivers that could potentially be associated with entomological indices to predict human West Nile virus incidence. This slide is showing the variables that I'm currently using to evaluate as part of my analysis, and as well as the data sources that I'm obtaining these variables from. So the data at a glance, this slide shows some of the mosquito data at a county level from 2012 to 2023. And it also gives a county level summary of the human cases. The 2 primary West Nile virus vectors in Pinal County and throughout Arizona are Culex tarsalis and Culex quinquefasciatus. When thinking about how mosquito surveillance connects with human West Nile virus incidence, a challenge we see at a glance is that some years there have been little to no cases in Pinal County, such as last year in 2023, there was 0. So this may or may not impact our ability to identify predictors for those years. I also haven't seen human West Nile virus data on a smaller geographical scale. So it'll be interesting to learn how well trapping and human West Nile virus instance data align spatially. Another challenge we anticipate is the frequency and distribution of mosquito trapping events, especially given the size of Pinal County and limited resources available, which actually leads me to my next slide. But before I go there, sorry, I'm putting the cart before the horse. But as you can see, in 2021, there were 121 cases, which is a huge jump from the previous year, which was 1, and the previous years before that. Before 2021, the highest numbers Pinal was seeing was 9, 8. So this has caused increased concern and warranting more exploration into those different drivers and how we can predict human West Nile virus incidence in Pinal. So this map shows where all mosquito trapping events have taken place between 2012 and 2023 in Pinal County. So as we would anticipate, the concentration of trapping is being conducted within municipalities and near urbanized regions of the county. And it also shows just how vast and spread out Pinal County is and how each of the municipalities are spread out. However, what we have done is define trapping sites being routine or not. So routine sites are those sites that have been visited at least 3 times within a trapping season. So this map displays routine sites in green. For analysis, those red sites are being removed. So this decision was made based on previous work that was actually conducted by my advisor and mentor, Heidi Brown. And the title and authors are found here. It's a great paper. I recommend it. But it is based on 2018 mosquito data from Arizona counties, in which they compared the trapping events between all trapping. They compared between all trapping events and routine trapping events. So these bar charts here kind of give a great summary of what they found. But once you remove all those infrequent trapping events, you see that the mosquito surveillance data can look very different. On the top left, this data comes from a county that has rigorous surveillance practices. Whereas in this bar graph here, we see that once we remove all the infrequent trapping and just look at the routine traps, then the data looks a little different. And so we see how drastic the data may look. It's also important to note from this map that many of these sites have moved over the years. I don't believe there has been any site that has stayed consistent from 2012 to present day. So just taking a cross section from our data, this is from 2021. So remember, this is our outbreak year here in Arizona. So just looking at a cross section of the data, the trapping sites at a glance are distributed throughout many of Pinal's municipalities. But once we remove infrequent trapping events, the geographic distribution narrows throughout the county towards the central and northern part of the county. So, and those sites are the green that we would include in our analysis. This map gives us a context when we look at county-wide data. Given the vastness of Pinal County, it would be ideal to look at mosquito and human data at a finer geographic scale, such as municipalities, census tracts, census blocks, zip codes. So continuing with our cross-section of the data, looking at 2021, These graphs display the trend of infection rates as calculated using maximum likelihood methods, comparing all trapping sites with routine sites across time in comparison with the onset of human West Nile virus illness. So I kept the infrequent trapping events in this visualization to see how the data may have changed. So for this particular year, there wasn't much difference in entomological indices when looking at all of the sites compared to just routine only sites. But a glaring difference, if you see here, is week 40. And so we see that if we include all the infrequent sites, week 40 shows actually the highest MLE, weekly MLE countywide in Pinal. But if we eliminate that, they're actually week 40 actually shows up as a 0 for if we're just looking at routine Culex tarsalis MLE. And then Quinque fasciitis, there was nothing as well. So this may have occurred if mosquito surveillance was conducted uniquely around a West Nile virus case, which different control and surveillance agencies may look at. If they hear that there's a case there, they might do 1 or 2 weeks of trapping around that area. So those instances would be removed from if you were just looking at routine only trapping events. We also see from these graphs a potential challenge when modeling this data, which is the 0 values in the middle of the trapping season. For example, here in week 36 and week 38, week 36 for Culex Quinque fasciitis, the quinks. So this is something that we are noticing as we're exploring this data, is there's lots of 0s in the middle of the trapping season. But we're still optimistic we can identify drivers for human West Nile virus instance given these 0s. From these graphs, we see that Culex MLE peaked about 3 to 4 weeks before the peak of human West Nile virus cases. That holds true for both vectors. And then looking at Culex, comparing the weekly abundance with weekly counts of human West Nile virus cases, we see that Culex tarsalis numbers seem to peak far in advance of human West Nile virus cases, whereas the quinks followed a similar trend as the human West Nile virus cases. And then looking at vector index, we see that for Pinal County in 2021, once again, Culex tarsalis seems more influential and may be important to predict human West Nile virus. However, it's important to note that these are just visualizations and they're only showing 1 year of data. And I happen to choose a year that had a lot of cases for this particular presentation. So there is no associated correlation analyses as part of this, but from what we can see, Culex tarsalis seems to have a further lag time to human West Nile virus cases. So the next steps, this project will continue beyond this PacVec training as it is a piece of my dissertation. We're still working through analyses and compiling environmental data with mosquito data. We currently have county level West Nile virus case numbers by Epi Week for Pinal County, but I have applied for access to census tract level human West Nile virus data, and I'm currently working with ADHS to obtain that data. So we're looking forward to that and doing a more finer geographic scale and analysis in Pinal County. I've gone over some of these, but challenges we currently are seeing as well as anticipate are the inconsistent trap sites. So we're going to lose data as we're only looking at routine trap sites. There's also a lot of empty traps as well. So there's a lot of zeros and different trapping events. And then is trapping occurring where West Nile virus cases are showing up? Hopefully we'll get a better idea of that if we do obtain the census tract West Nile virus data. And then there are years with little to no cases. Last year there was 0. There are some years where there was only 1 case. And so this might also pose a problem as well. But we are, again, optimistic that we'll be able to identify drivers for human West Nile virus instance in Pinal County to help Pinal County's public health efforts. I'd like to thank my mentor and advisor, Heidi Brown, as well as my dissertation committee for their continued input and involvement with this public health challenge, and PacVec for providing me this opportunity to present my research. Thank you.
Well, thank you, Tom, for your presentation. The floor's open for any questions. I see there's one in the chat from Anthony Smith. I don't know whether he wants to ask that question himself. If you can stop sharing now as well, your screen, Tom. There you go. Thanks. Anyway, Anthony asked a question. He says, I may have missed it, but what type of trapping is Pinal doing? EVS? Question mark.
So they're using CO2 traps. They don't use so it's basically a CEC light trap, but without the light, because they find that they're drawing too many other insects, but they do utilize CO2 at each of those sites.
Any other questions from the audience? I've kind of got one that I was thinking of when you were going through, because I mean that contrast between sort of the West Nile cases and positive pools in different years is pretty striking. So sometimes you had a lot in 2021, a lot of cases, a lot of positive pools. And in 2019, you had a similar number of, or a similar percentage of positive pools, right? But very few cases. So I guess that I know that you're kind of aware of this, or at least you mentioned it at the end of the talk. But is there value in sort of comparing those 2 years and the data from them to see if there's anything instructive that emerges from that comparison as to the reasons why there might have been fewer in one year and more in another year? Is it proximity to large urban areas, or what might be going on? Is there any sense of what's happening there?
Yeah, so and that table was just general data at a glance, but I found that when you eliminate those infrequent trapping events, so let's say there's a nuisance complaint, or you find out that someone got West Nile virus in this neighborhood, so you trap there for a week or two, that will increase your pool positivity. If you're identifying sites purely on that, and less on, these are routine sites to sample the community. So my guess, and this is only just a guess until I dive further into it, but once you look at just the routine sites being sampled and tested, you might see a little bit more connection between the actual instance of human West Nile virus and the pool positivities from those trap sites. So that's one of my guesses is, and what I anticipate might happen.
Okay, thanks. Any other questions?